let's talk about this MRI situation I had last night. So I had an 8 p.m. MRI last night because it was an urgent MRI, because the soonest one they had was sometime mid next week, and I couldn't wait because this is excruciating. I want to know what's going on. I need to know. So I picked the 8 p.m. and they didn't tell me it was urgent care. No one on the phone of the coordination people didn't tell me it was urgent care MRI services. Again, failed services. Failed healthcare at its finest. So we get there, we check in. That was fine. We only wait about 20-30 minutes, which is about average, because they can only do one person at a time. They only had one MRI. That's beside the point. So they call me back. I'm on crutches. They went over the questionnaire about metals, blah, 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 and then I changed into a scrub top. And there were two nurses. Remember that, there were two nurses. The one nurse that was assisting me in the ward into changing into the scrubs, she told me when I was coming out of the restroom that you cannot have your crutches in the MRI, past the MRI door. Okay, I get that. I understand that it's a magnetic field, whatever, and you have any certain metals that can't tolerate it. I understand that. But if you have someone who is disabled and someone who can't walk, they need help, right? Right. And so I told her, I'm like, I can't walk. I can't put weight on my right foot. I physically cannot put any type of weight on my right foot. Well, you can use us. You can use me. Okay. So the nurse stands next to me. I put my crutches to the side. The nurse told me. She links her arm. She's like, grab my arm. She said, I can't walk that way. I can't link arms and walk. So I tried putting my arm over her shoulder like you do when you can't walk. I can't let you do that. You need to link arms with me. What? That's not gonna work. Okay. So we find an alternative route. And, you know, if you can't walk, or you're physically incapable of getting to the MRI machine, and the nurse or someone is supposed to help you, assist you, and they can't, there's fail number 2. Your training should help be able to assist others, right? So technically, the way I had to walk into the MRI was on one leg, and I had to hop, 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 hop. And it was a good walk. And when someone is in excruciating pain because the muscle has separated from the bone, it hurts to high heaven. You feel it throughout your entire body. So I hopped along to the MRI. We get situated, and they give you just little earbuds. That was it. I've done MRIs before, and this was the worst of the worst. Like, terrible. So we get the headphones in, we get started. MRI is about a 25-minute thing. Gets done. And like, they didn't even check on me. They didn't say anything. How are you doing? You know, most MRIs that I have done have talked to the intercom and said, hey, making sure you're okay. You've got about 5 minutes left. You're doing good. You're doing good. No, nothing in that manner. Nothing whatsoever. So we get done. The nurse comes in, removes the cage, and it was just one this time, one nurse. I put my shoes on. She stands next to me. Well, she doesn't really stand next to me. She don't say nothing to me. But she just stands there. I'm like, okay, nothing. I'm just sitting there. She's like, oh, did you need some help? I said, yeah, I do. I can't walk. Hello? So again, I hopped to my crutches that were sitting outside the MRI door. They didn't even hand them to me. They didn't even do anything in that regard. Again, the healthcare has failed. Your training, regardless of what you do in any type of healthcare facility, you need to assist others that need assistance. Regardless if you're in urgent care at 12 o'clock at night or 2 o'clock in the afternoon, you need to train to properly assist people who physically cannot walk. Like, I know, like, I'm not in the worst position, but what if it was worse? What if it was someone who walked in that physically couldn't do that? No wonder we have a shitty healthcare.